Hello, I'm Emily Kerrigan, Domiciliary Care Policy Lead at QCS. It's hard to believe that Easter is nearly upon us. You might already be looking forward to tucking into a chocolate egg or two or meeting with family and friends. Whatever you may be doing, be sure to keep up to date with the latest news and updates on both the login page and dashboard. For weekly updates, be sure to also register for our weekly content bulletin email where you have not already done so. And as we are now firmly into spring, it is a good time to have a look at our new risk management policy and procedure, which is also this month's policy of the month. The policy will support in your understanding and management of risks across the whole of your service and has been created as an overarching policy which links out to other risk policies and resources within the QCS system. These include specific risk assessments and incident reporting, as well as a template risk register and a risk reporting form. We have also continued to see COVID-19 updates over the last month, with rules being relaxed across all regions of the UK. For England, self-isolation rules for those who test positive for COVID-19 were ended at the end of February. Government guidance was updated, and we have seen health and social care specific guidance also revised to reflect the relaxation of these requirements. In light of these changes, we have been busy updating our policies and resources, including the Coronavirus Policy and Procedure, COVID-19 Testing Policy and Procedure, Annual Holiday Policy and Procedure, and the Sickness Absence Policy and Procedure. We also saw the announcement of the decision to proceed with the revoking of vaccination in all health and social care settings, including care homes in England. This came into force on the 15th of March, and it is now no longer a requirement to ensure staff are vaccinated against COVID-19. Our employment law specialist NAPFNs have created an FAQ document, so please take a look at this in the Resource Centre if you have any questions about the changes. Our policies have also been updated in light of the announcement to ensure they reflect the current requirements, whilst the mandatory COVID-19 vaccination policy and procedure has been archived from the system as this is no longer required. In Wales, we saw the legal requirement to wear face coverings eased, with them only now being required in retail, public transport and health and care settings. The introduction of the long-term plan for living with COVID-19 was also introduced by the Welsh Government with two core planning scenarios, COVID stable and COVID urgent. In Scotland, the strategic framework has been updated to reflect the country's current situation with COVID-19. On the 21st of March, the legal requirement to wear a face covering in public indoor places and on public transport converted across to guidance. Premises and transport providers may still apply the guidance on a voluntary basis, as voluntary adoption measures may reduce transmission. Other remaining legal requirements will convert to guidance and good practice as appropriate. The Care Inspectorate in Scotland also announced they are no longer using Key Question 7, which was developed during the coronavirus pandemic. This information has now been included in Key Question 1, with a new Quality Indicator 1.5 having been developed, and Quality Indicator 1.4 also extended to include more information around people experiencing meaningful contact that meets their outcomes, needs and wishes. We will also continue to keep up to date with the latest COVID-19 requirements and update our policies and resources as guidance changes. The most recent policy updates can also be found on the QCS dashboard, so be sure to keep a lookout for any updates there. Some further content highlights from this month include: throughout February and March, all 15 of the UK GDPR-related policies have been reviewed and updated where necessary. The data protection and confidentiality policies have also been updated, and all GDPR forms have been checked and updated, including the Template Subject Access Request Letter, Privacy Policy Template, Privacy Impact Statement, and Consent Authorisation Forms. We also had another takeover of our weekly QCS email by our employment law specialist NAPFNs. If you missed it, the most recent resources that we shared included immigration rules relaxed for health and care workers, ACAS updates on bereavement advice, upcoming changes to the national minimum wage and national living wage rates come into force on the 1st of April 2022. All of the resources referenced can be found in the Resource Centre on the QCS management system, so please take a look. For For our supported living customers, we have been updating the policies which now have a greater focus on assessing specific behaviours and supporting planning. Some policy titles have also been updated, such as changing the double up home care policy to supported increased dependency in home care policy, which reflects supported living services. 5 brand new supported living policies are also available, including a texture modified diet policy, supporting tenancy agreements policy, and acquired brain injury policy. We also have 2 new easy reads for abuse and complaints, as well as an easy read template and guide to create your own to be specific to your supported living service. We also wanted to let you know about the QCS Dementia Centre developments that have taken place over the last month, should you not already have this feature within your system. Supporting people to live well with dementia is always a focus for service providers, and because this is a specialism that requires knowledge, understanding and skills, QCS has developed a range of resources to support you. Built around the internationally renowned PAL instrument, a valid assessment for understanding the ability of a service user with cognitive difficulties, the QCS Dementia Centre is a resource hub of evidence, tools and content offering guidance on how to deliver great dementia care. The tools will also help you to evidence excellence through identifying skilled staff actions and positive impact on service user wellbeing. Perfect for valuing team members and for being able to illustrate to regulators, commissioners and families the great service that you are providing. You can find out more or sign up for a free trial by visiting www.qcs.co.uk/dementia centre or call us on 0333 405 3333. That is all for this month's highlights. Please keep logging onto your system for updates and please let us know what you think of any of our content via our Facebook group.